Let's start by going back to 2021 when the pandemic was still raging, COVID-19 restrictions were still in place, and it was the leading cause of death, claiming 67,000 lives. Today, it is a very different picture. COVID-19 is no longer in the top 5. We may be looking for it less, testing less, and it is still significant. It is still deadly. 22,000 deaths over the course of last year. The question is whether that's the new normal or whether it will come down over time. Now, though, dementia, Alzheimer's is the biggest killer, followed by heart diseases. It's worth noting that both of these are killing more people than they did in 2021. And earlier this year, Sir Chris Whitty warned we'd have a prolonged period of excess deaths due to the pandemic because of delays in treatment while the country was in lockdown. We may be seeing some of that in the data. Now, this chart shows excess deaths over the last 70 years. The line across there shows how much higher they are than we'd expect compared to the previous 5 years, not including 2020 and 21 because of the pandemic. And deaths are 6.2% higher than the average. That is an extra 33,747 people who died last year, more than we'd expect. Now, the UK isn't alone here. This shows the number of excess deaths across Europe in the second half of 2022. And you can see that Germany, Spain, Italy, they all experience relatively high excess mortality. France, the odd one out, just dipping below there. Now, exactly why that's happening, we don't know. It's probably likely a combination of things. To start with, we have a growing and aging population, so more people would die. But even accounting for that, it's still higher than it probably should be. Next question is, well, how much is the effect of COVID-19, both in terms of postponed treatment, as Chris Whitty was warning, but also the disease's long-term effects on the general health of the population? How much, perhaps, is an overstretched NHS? And how long are excess deaths likely to remain high? Now, the ONS is looking into these questions, so are other organisations, and it's vital to understand the reasoning. Each percentage point difference on those charts represents thousands of lives saved or thousands gone too soon.